Hi, in today's video, we have another set of gross anatomy and embryology questions to test your knowledge and boost your USMLE preparation. A 60-year-old man presents with left shoulder pain and chest tightness. Imaging reveals a mass in the apex of his left lung, which has invaded nearby structures, including the upper thoracic region. Further evaluation leads to a diagnosis of a superior sulcus tumor. Shortly after, he develops signs consistent with Horner syndrome. Which of the following symptoms is most likely caused by the tumor's direct invasion of the stellate ganglion? Now, our task is to figure out which symptom is most likely a result of the tumor's direct extension into the stellate ganglion. The stellate ganglion is part of the sympathetic nervous system and, when affected, can lead to various symptoms, including those of Horner syndrome. The options provided are A. Adducted right eye, B. Hyperhidrosis, C. Meiosis of the left pupil, D. Pallor of the ipsilateral cheeks, E. Wasting of the dorsal interossei muscles of the hand. Option C is the most likely symptom resulting from the tumor's invasion of the stellate ganglion. The sympathetic nerves innervate the dilator pupillae muscle in the iris, which controls pupil dilation. When the sympathetic innervation is disrupted, as in this case with Horner syndrome, it leads to meiosis or pupillary constriction. This is the classic sign of Horner syndrome, and it matches the patient's symptoms perfectly. So meiosis of the left pupil is the correct choice. Let's have a look at why the other options are incorrect. Option A. This option refers to the adduction of the eye, which would involve the movement of the eyeball. It's important to note that eye movement is not controlled by the sympathetic nervous system. The extraocular muscles responsible for eye movement are innervated by the cranial nerves. An adducted eye is more likely to occur due to a loss of function in the lateral rectus muscle, which is innervated by the sixth cranial nerve and is not related to the sympathetic disruption. Option B, hyperhidrosis, is excessive sweating, and the question asks about effects of sympathetic nerve disruption. Horner syndrome, which the patient has developed, actually causes anhidrosis, which means lack of sweating, and not hyperhidrosis. This occurs because the sympathetic innervation to the eccrine sweat glands is interrupted. Therefore, option B is not the correct answer. Option D. While pallor of the skin might seem like a plausible symptom, it is actually flushing that typically occurs in Horner syndrome. And this happens due to the loss of the sympathetic vasoconstriction in the skin, which causes the blood vessels to dilate and results in a reddened or flushed appearance of the affected cheek. So pallor would not be seen, and this option is also incorrect. Option E. This option focuses on the muscles of the hand, which are innervated by the ulnar nerve. The tumor has invaded the stellate ganglion, which is part of the sympathetic nervous system, not the motor pathways to the hand. For muscle wasting to occur in the hand, the tumor would need to affect the lower trunk of the brachial plexus, which supplies the ulnar nerve. However, there is no indication in this case that the tumor has affected this area of the nervous system. So this option is not correct either. A 25-year-old hiker experiences persistent swelling and throbbing pain along the outer front portion of his right lower leg after an intense trek. He also notices difficulty lifting his foot upwards. Which of the following conditions is the most likely cause of his symptoms? Before answering this question, we should consider the location of the pain, the muscle groups involved, and the specific symptoms like difficulty with dorsiflexion, which will help us narrow down the potential causes and analyze which compartment of the leg is affected. The options provided here are A. Compression of the tibial nerve, B. Hemorrhage in the posterior compartment, C. Increased tissue fluid in the anterior compartment of the leg, D. Intermittent claudication, E. Ischemia of the superficial peroneal nerve. The correct option here is C, as this is the most likely cause of the patient's symptoms. The condition described here is anterior compartment syndrome. When there is an increase in tissue fluid or pressure within the anterior compartment, it can lead to compression of the deep peroneal nerve, which supplies the dorsiflexor muscles of the foot. And this results in severe pain, especially when the foot is dorsiflexed, leading to foot drop. The compartment might be tender or swollen to palpation, and this could be relieved through surgical decompression. Let's have a look at why the other options are incorrect. Option A. This condition would affect the posterior compartment of the leg where the tibial nerve innervates the plantar flexor muscles. However, the symptoms described by the patient don't match this option, as compression of the tibial nerve would typically lead to inability to plantar flex and not problems with the dorsiflexion. So this option is not the correct answer. Option B, a hemorrhage in the posterior compartment, could increase pressure on the tibial nerve, which would affect the plantar flexor muscles. This would result in an inability to plantar flex the foot. And option D, intermittent claudication occurs due to arterial insufficiency and typically causes muscular pain during exercise, which relieves with rest. However, the patient's pain is persistent, and additionally, dorsiflexion issues are also not a hallmark of intermittent claudication. So this option is also not the correct option. And option E, this condition would affect the lateral compartment of the leg, resulting in sensory deficits over the dorsum of the foot. However, it would not affect dorsiflexion, which is the key issue here in this question.